Okay, let's go over anti-anginal drugs. So first let's start off with some key terms, some things that you need to, concepts you need to understand and know what these terms mean. Let's start with angina pectoris, or chest pain, is when the supply of oxygen and nutrients in the blood is insufficient to meet the demands of the heart muscles ache, quote unquote. The heart requires a large supply of oxygen to meet the demands placed on it. Now let's talk about ischemia. What is that? That's poor blood supply to an organ. Ischemic heart disease is poor blood supply to the heart muscle. Atherosclerosis and coronary artery disease. Then myocardial infarction or heart attack, which I'm sure you all have heard before. This is necrosis or death of cardiac tissue. It can be disabling or fatal. So there's different types of angina. We have chronic stable angina, which is also called classic or effort angina. Unstable angina, also called pre-infarction or crescendo angina. And then vasospastic angina, also called Prismetals or variant angina. Drugs for angina and therapeutic objectives include nitrates, beta-blockers, and calcium channel blockers. I am going to go over and lecture on all the hypertensive medications in class this coming week. So goals of our treatment for angina include to increase blood flow to the ischemic heart muscle, and or depending on the situation, we want to decrease the myocardial oxygen demand. We want to provide more oxygen to the heart. So we want to minimize the frequency of attacks and decrease the duration and intensity of anginal pain. Improve the patient's functional capacity with as few adverse effects as possible. Prevent or delay the worst possible outcome, which is an MI. So the first group of medications we'll talk about are nitrates. Our available forms include sublingual, buccal, chewable tabs, oral capsules or tablets, and IV solutions. The ones with the asterisk next to them, so sublingual, buccal, and IV, bypass the liver and the first pass effect. So that also includes transdermal patches, ointments, and translingual sprays. I'm sorry, I didn't even look over there. So all of those are our preferred methods, or our preferred forms, I'll say, in emergency situations where a person is having extreme angina or extreme chest pain. We're going to use a translingual spray, ointment, transdermal patch, a buccal form or a sublingual form, or even IV form before we would use oral capsules or chewable tablets. The other ones are going to work quicker because they bypass the liver in the first pass effect. They cause vasodilation, so everything opens up really quickly because of the relaxation of the smooth muscles. It's a potent dilating effect on the coronary arteries. It's used for prevention and treatment of angina. Vasodilation results in reduced myocardial oxygen demand. Nitrates cause dilation of both large and small coronary vessels. The result is oxygen to the ischemic myocardial tissue, and the nitrates alleviate coronary artery spasms. You have rapid-acting forms used to treat acute anginal attacks, which include our sublingual tabs and our IV infusions, and we have our long-acting forms used to prevent anginal episodes. So nitroglycerin is a prototypical nitrate Large first pass effect with oral forms. It's used for symptomatic treatment of ischemic heart conditions, such as angina. IV form is used for BP control and perioperative hypertension, treatment of heart failure, ischemic pain, pulmonary edema associated with acute MI, and hypertensive emergencies. Go back for a sec. I can't go back. Well, the other thing I wanted, well, maybe it's in the next couple slides. Anyways, I'll speak more to nitro in class. Then the other nitrates that I will speak to is isosorbide dinitrate and isosorbide mononitrate. These are very common. They are used for acute relief of angina. Mostly I've seen these being used more for long-term prophylaxis treatments of angina. So we're trying to prevent angina from occurring. So prophylaxis in situations that may provoke angina. The most important thing with those medications is to tell the patient to take those medications at the same time every day. They take them at the same time every day. Any prophylaxis treatment, actually, if they take them at the same time every day, they will be more effective. Adverse effects include headaches, usually diminish in intensity and frequency with continued use. Tachycardia, postural hypotension, intolerance may develop. So one of the things you have to tell somebody, let's say their doctor has prescribed them nitro, and this is a person that periodically has to use a sublingual underneath the tongue because they have chest pain. My patient teaching when I have a patient that has nitro is I always make them tell me, how do you take your nitro if you have chest pain? It's very important that they grab their bottle of nitro and sit down. Put the tablet underneath the tongue, and what is going to happen? That medication is going to open up those blood vessels so fast that they could experience a head rush, a severe headache, so on and so forth. And most of these patients that have the nitro are older folks. They might have balance issues to begin with. So sit down, put the tablet underneath your tongue, especially if they've never taken it before. They don't know how it's going to affect them. But it really does have a very dramatic effect on what I mean by that is they can have that severe head rush or obtain a severe headache. So they'll put that tablet underneath their tongue and they're going to wait about 5 minutes. If the pain is still there, if the pain is still present, or they are still experiencing discomfort, they can put another tablet underneath their tongue. And they can do that up to 3 tablets and waiting 5 minutes in between. I always tell my patients, if they have nitro on board, you put 1 tablet underneath your tongue, you wait 5 minutes, you can put another tablet underneath your tongue and wait 5 minutes. If you have to put that 3rd tablet underneath your tongue, then you also at that time, when you put that tablet underneath your tongue, you also need to call 911, because if that tablet does not work, you're going to need to go to the hospital, and so you need to have emergency transportation on their way to take you to the doctor. Besides that, if you need to use 3 nitro tablets to resolve some chest pain, you need to get into the emergency room anyways to have an evaluation. So now let's talk about tolerance. It occurs in patients taking nitrates around the clock or with long-acting forms. Prevented by allowing a regular nitrate-free period to allow enzyme pathways to replenish. Transdermal forms, you want to remove the patch at bedtime for 8 hours and then apply a new patch in the morning. Beta blockers, let's talk about beta blockers now. The mechanism of action, we have block beta-1 receptors on the heart. They decrease the heart rate, resulting in decreased myocardial oxygen demand and increased oxygen delivery to the heart. They have a decreased myocardial contractility, helping to conserve energy and decrease demand. After an MI, a high level of circulating catecholamines irritate the heart, causing an imbalance in supply and demand ratio and even leading to life-threatening dysrhythmias. Beta blockers block the harmful effects of those catecholamines, thus improving survival after an MI. So that's why if a person is not on a beta blocker, that's why they are post-MI. Calcium channel blockers. The mechanism of action is to cause coronary artery vasodilation, cause peripheral arterial vasodilation, thus decreasing systemic vascular resistance, reduce the workload of the heart, and the result is decreased myocardial oxygen demand. First-line drugs for treatment of angina, hypertension, and supraventricular tachycardia. Coronary artery spasm, so Presmental's angina, and short-term management of AFib and flutter. There's also several other uses for calcium channel blockers, and I will talk to you about that more in class when we're going over all the hypertensive meds. Adverse effects include very acceptable adverse effect and safety profile. It can cause hypotension, palpitations, tachycardia, or bradycardia, constipation, nausea, dyspnea, and other effects. So what we need to consider, nursing implications. So before administering, you have to perform a complete health history to determine the presence of conditions that may be contraindications for those that may call for cautious use. You have to always obtain baseline vital signs, including respiratory patterns and rate. Assess for drug interactions. Patients should not take any medications, including over-the-counter medications, without checking with their doctor. Patients should be encouraged to limit caffeine intake. Patients should report blurred vision, persistent headache, dry mouth, dizziness, edema, fainting episodes, weight gain of 2 pounds in one day or 5 pounds in a week, and pulse rates less than 60, and of course, dyspnea or difficulty breathing. Nursing indications for nitro. Okay, I've already spoke to this a little bit, but let me just go through the slide. Instruct patients on proper technique and guidelines for taking sublingual nitro. Instruct patients never to chew or swallow the sublingual form. I did not say that, but that is part of your teaching. We want to put it underneath the tongue and let it dissolve. Instruct the patients that burning sensation felt with sublingual forms indicates that the drug is still potent. Instruct patients to keep a fresh supply of sublingual medication on hand. Potency is lost in about 3 months after the bottle has been opened. Let me say that again. Sublingual medication on hand, the potency is lost in 3 months after the bottle has been opened. So if they have a bottle that's not been opened, there's going to be an expiration date for the medication. Once they open that bottle, they need to write the day that they opened it on their prescription bottle and be mindful that that bottle is only going to be potent or quote unquote fresh for 3 months, and they need to get a new prescription. To preserve the potency, medications should be stored in an airtight, dark glass bottle with a metal cap and no cotton filler. We're going to instruct the patients in the proper application of nitrate topical ointments in transdermal forms, including to talk to them about site rotation and removal of old medication. To reduce tolerance, the patient may be instructed to remove topical forms at bedtime and new doses in the morning. Allowing for nitrate-free period. Instruct the patients to take PRN nitrates at the first hint of anginal pain. Don't wait. Take it when you have the first indication. Monitor vital signs frequently during acute exacerbations of angina and during IV administration. If experiencing chest pain, the patient taking sublingual nitro should lie down to prevent or decrease dizziness and fainting that may occur because of hypotension. I don't know if they need to lie down, but just having them sit down, they may need to lay down if they have extreme dizziness. So sitting down on the nearest chair would be the most ideal so that they don't fall. But if they know that the nitro makes them dizzy, like from past experiences of taking it, then if they could grab their nitro, if this was a patient that told me that, then I would say grab your nitro and go to your couch and sit down just in case they needed to kind of lay down if they did extreme some severe dizziness. All right, and this is what I spoke to a few minutes ago. So if anginal pain occurs, so with nitro, what are we going to do? We are going to stop the activity and sit or lie down. Grab your nitro first. Take a sublingual tablet and call 911 immediately. You will see differentiations of when to call 911. It really kind of depends on the physician, but according to your book, it says take one and call. So that's what I want you guys to remember. You'll see as you work with the physician, like what their instructions are, and you'll kind of get comfortable with the way you want to teach. But regardless, they're going to take a sublingual tab and they're going to call 911. We want to make sure that there is someone en route to this person in case we can't resolve the angina with these sublingual tablets with the nitro. If no relief in 5 minutes, take a second sublingual tablet. If no relief within the next 5 minutes, take a third sublingual tablet. Do not drive to the hospital. We need to make sure that we are very clear about that. They think that they can drive after taking nitro. That's not a good idea. IV forms of nitro must be given with special non-PVC tubing and bags. Discard parenteral solution that is blue, green, or dark red, and follow specific manufacturer's instructions for IV administration.